Ladies and gentlemen, I'm honored to have the opportunity to speak at this conference. I'm Xiaohong from Hunan Cancer Hospital, China. My presentation is psychological reactions and interventions to help cancer patients cope during the COVID-19 pandemic in China. I'm the Vice President of Hunan Cancer Hospital and the affiliated Cancer Hospital of Xiangyang School of Medicine, Central South University, and Chairman of Chinese Psychosocial Oncology Society of Chinese Anti-Cancer Association. Since the outbreak of the COVID-19, we have been concerned about the psychological problems on cancer. The team of this study is consisted of oncologists, nurses, psychological consultants, psychiatrists, clinical spiritual caregivers, and social workers from the Department of Clinical Oncology, Psychosocial Oncology, and Clinical Spiritual Care of Hunan Cancer Hospital. And our study is supported by Beijing Hope Marathon Fund of Cancer Foundation of China. My presentation includes the following 7 parts. COVID-19 pandemic has had a significant negative impact on cancer patients in China. Most travel masks are still available in most areas of China, but travel is influenced to a certain extent. Cancer patients have been asked to reduce travel or stay at home. Psychosocial problems of cancer patients are increasing. Psychosocial support and clinical spiritual care for cancer patients are needed. For patients with moderate or severe anxiety or depression, psychological interventions are necessary. As the leader of Psychosocial Oncology and CSC group of Hunan Cancer Hospital, I would like to introduce the main tasks of the group, which includes investigation and prevention of mental health and psychological interventions for the medical staff, psychological investigation and interviews, which cancer in patients, online psychological assessment, and psychological interventions, delivery for anti-epidemic medical staff, mental health education for medical staff, patients and their family members, education about anti-epidemic and anti-cancer topics for patients, and overall research, education, and clinical experience of psychosocial oncology and CSC staff. Psychosocial problems and needs of cancer patients are increasing due to the pandemic. A psychological survey of 1,090 cancer patients and their families in Hubei province, the province with the most cumulative COVID-19 cases in China, showed the patients with psychological problems increased from 36.95% to 43.84% and 40.19% of participants needed psychosocial support. Lack of access to cancer treatment centers caused cancer patients to worry about treatment. Some of the cancer hospitals, such as Hunan Cancer Hospital, opened for both anti-COVID-19 and anti-cancer treatments. This hospital increased measures to rule out COVID-19 and then followed cancer treatment. Prevalence of distress in healthcare workers and patients. In Hunan Cancer Hospital, the proportion of medical staff with anxiety and depression were 21% 1.4% and 16.7% respectively. For persons with moderate or severe anxiety or depression, online interviews, CSC, and psychological interventions are provided. Relaxation exercise, tea culture intervention, cognitive therapy, mindfulness, and music therapy are generally used. During the COVID-19 epidemic, 13 patients with possible emotional problems were referred to the Department of Clinical Spiritual Care. Psychologists conducted interviews showed that the most common problems were sleep disorders, which was 33.3%, followed by emotional problems, which was 23.3%. Poor physical condition and economic problems were 13.3% and 10% respectively. For patients with above problems, the treating psychiatrists offered companionship, listening, cognitive behavior therapy, painting therapy, and tea culture interventions. Sources of patient distress. There were several sources of patient distress. First, patients concerned about treatment delays. Some patients could not travel to hospitals for treatment as scheduled due to lockdowns in some cities. Travel to Changsha took more time than before due to strict epidemic prevention and control measures on travel. Second, patients concerned about being infected by COVID-19. Some patients developed chronic anxiety about symptoms and ailments, especially those with symptoms similar to coronavirus infection. Inappropriate behavior could occur during anti-cancer treatment. For example, some cancer patients repeatedly sought medical treatment for COVID-19, although doctors had already ruled out COVID-19 infection, and some patients had overprotective behaviors, including wearing raincoats and shoe covers when they went outside. Third, patients' concerns about the negative economic impact on their families caused by the COVID-19 epidemic. At the level of the household, the COVID-19 epidemic has resulted in loss of income and an increase in spending on healthcare. Hospital stays were longer due to longer appointments for medical examinations and treatment. Some patients are unemployed or have reduced incomes. Most patients experienced inconvenient travel conditions and increased travel costs. Cancer patients worried more about anti-cancer treatments than economic problems because most cancer patients could afford the medical care, and Chinese people are used to save money on regular basis for future living expenses. Fourth, negative social support. During the COVID-19 pandemic, cancer patients' social support dropped sharply. In some areas, cancer patients were quarantined at home and lacked communication. The patient's access to medical information was delayed, and the questions about the COVID-19 and cancer treatment could not be answered in time. Social isolation could cause psychosocial problems. Cancer patients were more prone to experience fears of disease progression, anxiety, and depression. Fifth, misunderstandings about COVID-related information. Experts prediction of the epidemic of COVID-19 was relatively accurate, but some patients misunderstood this data. Some patients were excessively pessimistic and panicked about the outbreak. Patients' unwillingness to go to hospitals during the COVID-19 pandemic caused treatment delay. Sixth, breakdown in communication with healthcare providers. Although patients respect medical staff in the fight against the COVID-19 epidemic, patients tend to irritable, anxious, and dissatisfied with medical staff, which caused conflicts between doctors and the patients. Assessments and referral. Online psychological evaluation was performed on patients, include self-rating anxiety scale and self-rating depression scale. For patients with moderate or severe anxiety or depression, online interviews were conducted. Patients who needed psychiatry medication were referred to the local psychiatry clinics. Psychological interventions were interventions for patients who did not need psychiatry medication. Open and accessible online psychological counseling hotlines and platforms were available during the COVID-19 epidemic, including National Platform of Psychological Crisis Intervention for COVID-19 and the Psychological Assistance Hotline of Changsha City. During the epidemic, the clinical spiritual care team insisted on carrying out spiritual care concerns for cancer patients in Hunan Cancer Hospital. Psychosocial support measures. The National Health Commission of China have released guidelines on public psychological self-help and intervention for COVID-19 and promotes psychological assistance and social worker services for patients, medical personnel, and the general public during the outbreak of COVID-19. Based on the experience of Hunan Cancer Hospital, there are measures to provide psychosocial support for cancer patients. First, ensure that psychological consultation and psychological clinics remain available. Second, psychological counselors on duty to provide psychological counseling service to patients. Third, for patients with travel restrictions, online psychological counseling was provided. Fourth, online training and education for patients was helpful. There were important steps taken to keep psychological consultation clinics available. First, strengthening in prevention of COVID-19 anti-epidemic measures included multiple quarantine checkpoints in hospital for fever screening, investigation of contact or travel history to epidemic areas within 14 days for all patients, requiring the wearing of masks at hospitals, limiting the number of outpatients and inpatient visits, and regular hospital disinfection. Second is ensuring relatively sufficient supply of protective equipment for COVID-19 in psychological clinics. Despite the tight supply, of protective equipment, Hunan Cancer Hospital attached importance to psychological clinics as to other clinics. Other steps include strictly executing screening, diagnosis, and treatment of COVID-19 infection, steadily increasing the hospital's capacity of treating cancer patients to the pre-epidemic level. Doctors and nurses voluntarily provided necessary medical services on weekdays and weekends. Online healthcare platform was built to provide medical service for cancer patients. An isolation room was reserved for each ward, strengthening education on COVID-19 epidemic prevention, cancer treatment, and adverse reactions, and music therapy for hospitalized patients. Support for healthcare workers. Major manifestation of psychological problems of healthcare workers were anxiety, depression, acute stress disorder, and post-traumatic stress disorder. The following suggestions are helpful for healthcare workers based on our experience. Release negative emotions as soon as possible. Avoid overwork and maintain proper physical exercise. Take advantage of social support system. Establish mutual trust relationships between doctors and patients, and seek psychological counseling if necessary. Online psychological counseling may be more appreciated than in person. Psychological supports including clinical spiritual care, meditation, relaxation exercise, tea culture intervention, mindfulness, and music therapy were used. Clinical spiritual care is a type of psychological intervention which aims to provide professional, holistic care for patients and the family and the hospital staff during time of illness, injury, trauma, distress, and dying and death. This service includes spiritual and ethical consultation and education training. Based on our experience, CSC is the most useful type of psychological supports. Summary and conclusions. First, during the COVID-19 pandemic in China, psychosocial problems and needs of cancer patients and healthcare workers were increased. Second, main source of distress were anxiety around delayed or missing cancer treatments, fear of catching COVID-19, economic struggles, and social isolation. Third, strategies to make psychosocial support stronger for cancer patients are necessary, and measures based on the experience of Hunan Cancer Hospital may be helpful to others caring for people for cancer during this pandemic. We have published 2 articles in the Journal of Psychosocial Oncology Research and Practice and Integrative Cancer Therapies in 2020 and 2021. Our team have 5 oral presentations at the 22 World Congress of Psycho-Oncology and Psychosocial Academy, include 2 individual oral presentations and 3 rapid oral representations. My deepest gratitude goes first and foremost to the presidents of Hunan Cancer Hospital, Professor Hua Yueyu and Professor Yazhou Xiao. Special thanks should go to express my gratitude to the Chinese Psychosocial Oncology Society of Chinese Anti-Cancer Association, Hunan Cancer Hospital, and affiliated cancer hospital of Xiangyang School of Medicine, Central South University, Hunan Provincial Clinical Spiritual Care Management Committee of Hunan Hospital Association, Psychosocial Oncology and Clinical Spiritual Care Group of Hunan Cancer Hospital, and the Department of Hospice Unit of Hunan Cancer Hospital. Thank you. Thank you for all.